Anterior views right here. You can see the apex right here, and the base is the top portion of the heart. The epicardium and pericardium would be the outer covering of the heart. The myocardium would be this really thick portion right here. So epi or pericardium, myocardium here, and then endocardium would be the inner lining right here. Is this what she said, the endocardium?
Mm-hmm.
The inner white lining right here. The endocardium. Okay. The interventricular septum. Let's see if I can find it. I don't know if I can see it in here in this heart. Can we?
I don't think so, because you will have to cut it
in the middle.
Mm-hmm.
Yeah. It separates the two ventricles, so it should be right in the middle of this. If I took it and made a cut straight down the middle of this like that, we would see it separating the two ventricles. The vena cava, let's see if it's on here. It should be on this side of the aorta. I think it's right. Is it right here, Eva?
Yeah, because that would be the pulmonary.
Yeah, it's going into the right. This would be the vena cava, superior. Inferior one should be coming out at the bottom down here, somewhere down here. Can't really see the inferior one on this. The pulmonary trunk is right here, and you can see it kind of comes through, and it would branch off to each separate lungs. This is the pulmonary trunk. The pulmonary veins, if we go to the posterior side view here, let's see if I can see them. It's kind of hard to see. Pulmonary veins. I think they're within this thing somewhere.
Just say that.
Pulmonary veins. It would be the pulmonary trunk will take the blood to the lungs, and the lungs would bring the oxygenated blood back to the heart through the pulmonary veins. But they're hard to see on here. The aorta is this really thick thing right here. It goes down into the aortic semilunar valve. The coronary A and V, right and left. Okay, we can't see that on here. The veins are hard to see. They're kind of a little bit there. I don't think she'll ask about that. The
sinus.
Coronary sinus is a structure that is right in between. The coronary sulcus is the space between the ventricles and the atrium, right in here. So the coronary sulcus is the indentation between the ventricles and the atrium. And the coronary sinus is the structure that sits in there. So I'm not quite sure. This kind of looks like how it is in the book. This little section right there, if it's on the I would guess coronary sinus. So the interventricular sulci, that's this indentation right here on the anterior side, interventricular sulci. The right and left atria, so this would be the right atria right here. This would be the left atria right here at the top. The right ventricle would be this right here, right ventricle, and the left ventricle would be this right here, the bottom portion that kind of comes more posterior. So we have the right ventricle, right atria, the left ventricle, left atria. Right and left atrial appendages auricle. Okay, so the auricle is hard to see in this. Okay, this is the right auricle. The left auricle, I'm not sure where it is. It might be cut off. It's harder to see, or it's easier to see in the models.